The next segment was taped during the coronavirus stay-at-home order. It's normal for people to experience anxiety and fear, but usually only for a short period of time. My next guest, Kendra, says her anxiety and panic attacks became so paralyzing that they robbed her of a shot at an Olympic medal. Take a look.
Growing up, hockey was my thing. I knew I wanted to play in the Olympics, and I was doing everything I could to achieve that goal. I was playing in the top women's league in Canada. In '99, I was at a Team Canada camp. I was convinced I was having a heart attack. I couldn't eat, I couldn't sleep, but I just knew I wasn't okay. And I went to every doctor you could imagine. The number of times that I ended up in the emergency room, I lost count. Everybody just kept telling me I was fine. The day I was told I made the team, I walked away to find out what was wrong with me. I just walked away from the only dream I've ever had. A few weeks later, I received a diagnosis of generalized anxiety, panic disorder, panic attacks, agoraphobia, OCD, and clinical depression. It was so debilitating. I couldn't go to school. I couldn't work, thinking that there's something catastrophic happening that you're not going to be able to stop. It became my reality. My fear was so great all the time. It was exhausting. It took over my life and cost me my dreams.
Kendra is joining me via Zoom, along with my very dear friend, Dr. Freda Lewis-Hall, Senior Medical Advisor of Pfizer. Kendra, things must have been hard to end up walking away from your Olympic dream, so tell us about that. How bad did things get for you on the anxiety front?
Dr. Phil, I got to a place where I couldn't leave my apartment for 5 years.
So tell me what has changed since.
I started engaging in therapy, found the medication that works for me. I focus on eating right, staying physically active. I really try to stay engaged in yoga, mindfulness, and I actually quit drinking alcohol as well, which made a huge difference for me.
Oh, that's great. Now, Dr. Freda, it's so good to talk to you again. Nearly 1 in 5 Americans struggle with mental illness, as you and I know. It took Kendra 10 years before she got help. That's about the norm, though, really, isn't it?
Unfortunately, yes. In anxiety disorders, which are the most common mental health disorder in the United States, affecting over 40 million adults. And Kendra did an excellent job in sharing what this experience can be like. People may feel extremely worried and nervous about things, even when there's no real reason for worry.
Well, and it's not uncommon for someone with an anxiety disorder to also suffer from depression. So tell us more about some of the symptoms of depression.
It is true, depression and anxiety can go hand to hand, and it's important to know the symptoms of depression. Dr. Phil, as you know, some of the common symptoms of depression include feeling sad or hopeless. It also may include losing interest in things and activities that you used to feel enjoyment with.
Right.
Fatigue is a symptom, as well as sometimes not being able to concentrate well. And interestingly, men and women, the symptoms may look a little different.
Well, talk us through some of the causes of anxiety and depression so people understand where this is coming from.
So anxiety and depression can be brought on by a host of factors. They include genetic, biological, environmental, psychological. So think about things like the importance of a family history, stress, trauma, major life changes. It can even be the result of the use of certain medicines.
Kendra, was there ever a time when you thought you just would not be able to manage your mental illness?
Sadly, yes. I remember, especially after I left Team Canada, I got to a point where it was really tough to see myself getting to tomorrow. And I know that there were times that it wasn't necessarily so much that I didn't want to be here. It was that I couldn't see myself surviving this.
Yeah, and I really want people to understand that suicidal thoughts are not just harmless bids for attention and should be taken seriously. There's a myth that people that talk about it don't do it, or that it's just attention-getting behavior. That is absolutely not true. With regard to that, Kendra, how are you doing now?
I'm doing great. Now in my life, I'm married. I have two wonderful boys. I actually work as a firefighter now, and I'm very fortunate that I get to travel the world and share my journey with mental illness as a motivational speaker.
Getting that medical help is so important, right, Freda?
Oh, absolutely. Talking to your doctor is critical. As with any medical condition, getting a diagnosis and getting a treatment plan that's right for you is so important. And in this particular instance, it's really important to not allow perceptions of stigma or any shame that you may feel to stand in your way of getting help.
Give some of your advice or guidance, what you would say to someone who has a friend or a loved one with mental health problems.
So, first of all, it's important to listen. Be sure that you're listening non-judgmentally. And you also want to be sure to be calm and reassuring, as well as encouraging and supporting the person to seek help. And of course, you can help by taking them seriously and also helping to call a mental health professional and, if necessary, to call the National Suicide Prevention Lifeline. And I want to give you the number because this is really important. It's 1-800-273-TALK. I'll repeat that, 1-800-273-8255.
I often tell people they deserve the help as much as they need the help. To learn more about mental illness, make sure and check out one of my favorite websites, gethealthystayhealthy.com. It is an outstanding resource for any health-related issues. And obviously, I want to thank all of my guests today, especially my dear friend, Dr. Freda Lewis Hall. I'm so excited that you were here and talking about this. And Kendra, thank you for being here as well.
Thank you so much for having me, Dr. Phil.
Thanks to you.